Esteemed viewers, when discussing naturalness, we will of course not be talking about breast augmentation through non-surgical herbal remedies or other methods. We will not discuss the surgeries. The procedures are called breast augmentation surgeries. But in this interview I specifically want to emphasize the natural appearance of the final result. For the breast augmentation procedure to achieve a natural look, the primary requirement is the absence of any scarring on the breast region. Should it result in any scarring, whether it be around the areola or along the crease beneath the breast, in the end this is considered a natural outcome. It ruins it. Natural breast augmentation. We are able to perform exclusively through the underarm technique. In this operation, performed by entering under the armpit, we make an incision of approximately 1.5 to 2 centimeters, and these incisions follow the armpit lines, since we are planning it to run parallel to the natural creases found in the armpit area. After surgery, the patient or even I, the surgeon, won't be able to find the scar, to locate or identify this particular scar. Consequently, because we will achieve the desired breast volume increase without creating any visible scarring on the breast tissue itself, the mammary gland, as we avoid any scarring, the final outcome will inherently appear natural and authentic. Certainly, another element that determines the naturalness of the final result is the size of the breast, its ultimate dimension. Here, I always tell my patients during the examination this: the optimal breast size should fall between the 80 and 85 size range. It ought to lean towards the 85 size. If the breast becomes too large, if it is made very large using very large silicone prostheses, if results around a 90 band size or even larger are achieved, speaking as an average example, this will look garish in very common terms. It will draw excessive attention, practically announcing its presence, and under no circumstances will it appear naturally organic. If we are capable of successfully creating the desired fullness in the cleavage area for a breast size averaging 85, which is something, we can do this. If we can place the breasts close together, which we really can do, that means a natural result. And it means the patient is happy with the result. In summary, I want to say this: for a breast augmentation surgery to look natural, it should appear as if that breast has reached its final state after puberty, after it has completed its development, as if it is in its state then, so that we can accept it as natural. The second point is no scar. The third point requires that the size chosen must be naturally suitable and of an appropriate dimension. Ultimately, I can state this: following a breast augmentation procedure, you can achieve natural, authentic and wonderfully enhanced breasts.